Decision to overturn Roe v. Wade raises medical and legal questions.
Many women and doctors grappling with the impact and exactly what it means for the care of expectant mothers. Shannon Murray is here with a look.
Lauren and Tim, the ruling halted access to abortion immediately in Texas, leaving doctors who could face a felony to consider what that means when a woman has a miscarriage or other pregnancy complications. Dr. John Thoppel is the president of the Texas Association of Obstetricians and Gynecologists. On Good Day this morning, he said the ruling could impact how doctors handle a high-risk scenario, like ectopic pregnancy, when the fertilized egg grows outside the uterus, requiring a fast response to save the mother. It also raises questions about the abortion pill. It is authorized by the FDA for use within the first 10 weeks of pregnancy, but Texas law bans mailing it into the state. Dr. Thoppel says the medication is prescribed by doctors in other scenarios, not just abortion. He's worried about the unintended consequences of the ruling.
We do prescribe misoprostol for induction of labor, pre-procedure, for treatment of miscarriage. And so these are the kind of things we're worried about if pharmacists refuse to fill it with, concern for the purpose that we're writing it for. So I think there's a lot of fear of how things are going to be interpreted based upon the ruling.
First of all, medication abortion is the great limit on the anti-abortion state's ability to control this, right? If medication is readily available and can be used by so many people to terminate pregnancies, that's going to be harder for those states to police. But I think some states have tried to ban the shipment into the state. Whether they will succeed is really going to be a question for the courts.
Attorney Joanna Grossman also predicts legal battles over whether women can cross state lines to get an abortion. She says many states, like Texas, will likely try to criminalize those who help the woman get there, as opposed to going after the out-of-state provider. And Dr. Thoppel also says the ruling could impact training. He says Texas medical students may have to travel out of state to learn abortion care and even how to properly handle miscarriages and other pregnancy complications. Tim and Lauren.